The following video is an educational guide for pregnant women and their families. All visuals are for demonstration purposes only. Your labor and birth experience may be different. This video is not intended to replace any medical exam or consultation with your doctor or midwife. We recommend that you practice these methods at home to get used to them before going to the hospital in labor. Your labor is progressing and you are approaching birth. Your baby is moving down into your pelvis, giving you a strong urge to push. Welcome to the second stage of labor. When it comes to birth positions, you can use gravity to speed up the birth of your baby. Or you can use a gravity-neutral position. More on that in a minute. But first, let's start with an example of a gravity position, squatting. This opens your pelvic outlet to its maximum size. Your support person would sit behind you, supporting you when you need to lean back and rest. Because squatting can be exhausting, you may want to use a birth stool. Sitting on a stool flexes your legs and expands your pelvis. Some women choose a squat bar on their labor bed. During contractions, move forward and squat like a frog, holding the squat bar for support. If the bar is too high for you to squat comfortably, or if an epidural has made your legs numb so that it's hard to squat, you can loop a towel or sheet over the top of the bar. As you push, pull back on the towel or sheet. If you find that squatting is too difficult and you want to rest between contractions, try a gravity-neutral position. Gravity-neutral positions take the baby's weight off your back, allowing your pelvis to open up. They also make breathing easier, stabilize blood pressure, and prevent perineal tears. One example, laying on your side, helps turn your baby's position and can stimulate contractions. It's also good for when the baby could use some help coming out. To make your pelvic outlet even bigger, your support person can hold up your upper leg and joints. For some extra comfort, put a pillow between your legs, or you can ask for a peanut ball. To use one, bring the ball as close to your hip as possible. Then bend your upper leg at the knee and drape your leg over the ball. Side lying is also good for women who have had an epidural because the medication limits mobility. The medication is also gravity dependent, so to distribute it evenly, rotate your body to its other side every hour to hour and a half. Hands and knees is another gravity-neutral position. In yoga, they call this the cow position. With your hands positioned under your shoulders, put your hands on the ground or bed with a pillow beneath them. Your knees are under your hips. Go ahead and rock your pelvis back and forth, or go into the yoga cat position. Take a breath, arch your back, tuck in your belly, and round your shoulders. Then go back to the cow position. Another yoga position you can do is called a child's pose. It's like the cow position, except your elbows, forearms, and hands are all on the ground or bed with a pillow underneath them. Being on your hands and knees is a good position for massages. You can also use a heat or cold pack, as long as it doesn't directly touch your skin. The most common position for pushing is also gravity neutral. It's the reclining or semi-seated position. You would be sitting on a bed with your legs bent and in front of you. Your support person could be sitting behind you with his or her legs on each side of your hips, or standing at the side of your bed. With each contraction, lean slightly forward, grab your thighs and pull them back gently. Push down on your diaphragm 3 to 4 times with the lower part of your body, taking in 3 to 4 breaths. Or bear down with your lower abdominal and pelvic floor muscles 3 to 4 times with each contraction, directing your exhale down through your body. When a contraction is over, relax and change your position. Rest your legs, arms, and body completely. Sometimes the weight of the baby will press against your blood vessels, causing some discomfort and pressure. To relieve the pressure, turn slightly to one side and place a pillow under one of your hips. You would also be reclining or semi-seated if you had an epidural. Practice and experiment with these positions before you go into labor. When you practice, do not push. Just work on your positioning. And don't forget to make use of other comfort and relaxation techniques that you enjoy, like essential oils, massage, and breathing techniques. Most importantly, throughout your labor, always remember you can do this. And you have partners right there with you to support and help you.